Your patient has been prescribed tramadol 50 mg tablet for pain relief. Upon receipt of the tablets from the pharmacist, you will option A. Record this in the controlled drug register book with the pharmacist's witnessing. Option B. Put it in the patient medicine port. Option C. Store it in ward medicine cupboard. Option D. Ask the pharmacist to give it to the patient. Correct answer is A. So in the UK, tramadol is a controlled drug and it should be recorded in the controlled drug register book with the pharmacist witnessed. An elderly client tells you that the carer is using his money when going shopping and not buying him any food. The client appears malnourished and weighs only 35 kg. As a newly qualified nurse, what is your action? Option A. Listen to clients and raise concern with line manager. Option B. Do nothing as he is confused. Option C. Listen to the client and call the safeguarding lead. Option D. Listen to the client and confirm with the carer. Answer is A. So this is one of the safeguarding issue, but before going to the safeguarding lead or calling to the safeguarding lead, you have to listen to the client and raise the concern with the line manager. When will you disclose the information about a patient under your care? Option A. Justified by public interest, law and order when there is a threat to public safety. Option B. When the media demands for it. Option C. When patient relatives wish to. Option D. You can disclose it anytime you want. Answer is A. Justified by public interest, law and order when there is a threat to public safety. Dennis was admitted because of acute asthma attack. Later on in your shift, he complains of abdominal pain and vomited. He asks for pain relief. Which of the following prescribed analgesia will you give him? Option A. Fentanyl buccal patch. Option B. Ibuprofen enteric coated capsule. Option C. Paracetamol suppositories. Option D. Oromorphine. As the patient is having vomiting, so it's better not to give the oral tablet or any buccal patches. So best answer is paracetamol suppositories. You were asked by the nursing assistant to see Claudia, whom you have recently given trimethoprim 200 mg pure because of urine infection. When you arrived at her bedside, she was short of breath, wheezy and some red patches evident over her face. Which of the following action will you do if you are suspected anaphylaxis? Option A. Call for help and give oxygen. Option B. Give oxygen and salbutamol nebulizer if prescribed and call for help. Option C. Give oxygen, administer adrenaline 500 mcg IM. Give salbutamol nebulizer if prescribed and call for help. Option D. Call for help, give oxygen, administer adrenaline 500 mcg IM, give salbutamol nebulizer if prescribed. Correct answer is D. Call for help, give oxygen, administer adrenaline 500 mcg IM, give salbutamol nebulizer if prescribed. We are monitoring a patient in ICU when suddenly his consciousness drops and the size of one of his pupils becomes smaller. What should you do? Option A. Call the doctor. Option B. Refer to the neurology team. Option C. Continue to monitor the patient using GCS and records. Option D. Consider this is an emergency and prioritize ABC. The correct answer is D. Consider this is an emergency and prioritize ABC. An overall risk of malnutrition of 2 or higher signifies option A. Lower risk of malnutrition. Option B. Medium risk of malnutrition. Option C. Higher risk of malnutrition. Answer is C. High risk of malnutrition. A nurse documented on the wrong chart. What should the nurse do? Option A. Immediately inform the nurse in charge and tell her to cross it all off. Option B. Throw away the page. Option C. Write a line above the writing. Put your name, job title, date and time. Option D. Ignore the incident. Correct answer is C. Write a line above the writing. Put your name, job title, date and time. A patient is in the immediate recovery post-surgery. What should you monitor? Option A. Breathing. Option B. Temperature. Option C. Blood loss. Option D. Pain. The correct answer is A. Breathing. A patient's daughter wants to visit her mom in the hospital. She has been experiencing diarrhea. What will you advise her? Option A. Advise visiting when she feels better. Option B. Advise her that she can visit when she is 48 hours symptom free. Option C. She can visit when she is fully recovered. Option D. None of the above. Answer is B. Advise her that she can visit when she is 48 hours symptom free. The infection control nurse found and reported to you the following result of sample taken from 4 patients in Bay A. One of the patients tested positive for MRSA, another tested positive for clostridium difficile, and the remaining 2 were negative for both. Your ward has one isolation room only. What action will you do? Option A. Put a patient with C. difficile in an isolation room. Option B. Put a patient with MRSA in isolation room. Option C. Transfer the 2 patients who are negative for both infections to another bay. Option D. Keep them all in the same bay but reinforce strict hand washing. Answer is A. Put a patient with C. difficile in an isolation room. Which is the most dangerous site for intramuscular injection? Option A. Ventrogluteal. Option B. Deltoid. Option C. Rectus femoris. Option D. Dorsogluteal. Answer is D. Dorsogluteal. So with the dorsogluteal intramuscular injection, there is a chances of damaging the sciatic nerve, and with that the patient will have the complete paralysis of muscle, which is supplied by the sciatic nerve, and the person may have the sensory loss and also the paresthesia. You believe that an adult you know and support has been a victim of physical abuse that might be considered a criminal offense. What should you do to support the police in an investigation? Option A. Question the adult thoroughly to get as much information as possible. Option B. Take photograph of any sign of abuse or other potential evidence before cleaning up the victim or a crime scene. Option C. Explain to the victim that you cannot speak to them unless a police officer is present. Option D. Make an accurate record of what the person has said to you. Correct answer is D. Make an accurate record of what the person has said to you. If you suspect abuse is happening to someone and it is not serious enough to involve the police straight away, whom should you inform? Option A. A manager with safeguarding responsibility if within an organization, or adult social care directly if you are a member of the public. Option B. No one. It is up to the adult at risk to raise the alert. Option C. The adult's next of kin. Option D. Everyone with caring responsibility for the adult. The correct answer is A. A manager with safeguarding responsibility if within an organization, or adult social care directly if you are a member of public. Before administering digoxin, you must check specifically for what? Option A. Breathing. Option B. Temperature. Option C. Heart rate. Option D. Loss of consciousness. Answer is C. Heart rate. Mr. Connor's neck wound needed some cleaning to prevent complication. Which of the following concept will you apply when doing a surgical wound cleaning? Option A. Surgical asepsis. Option B, aseptic non-touch technique. Option C, medical asepsis. Option D, deep tip technique. Answer is B, aseptic non-touch technique. For lumbar post-operative patient, moving and handling is option A, move patient as a unit. Option B, move patient close to side rail so he or she could assist herself. Option C, move with leg raised and flexed. Answer is A, move patient as a unit. IV injection need to be reconsidered when option A, medicine is available in tablet form. Option B, poor alimentary absorption. Option C, drug interaction due to GI secretion. Answer is A, medicine is available in tablet form. In interpreting ECG results, there is a clear evidence of atrial disruption. This is interpreted as option A, cardiac arrest. Option B, ventricular tachycardia. Option C, atrial fibrillation. Option D, complete blockage of heart. Answer is the C, atrial fibrillation. Enteral feeding patient checks patency of tube placement by option A, pulling on the tube and then pushing it back in place. Option B, aspirating gastric juice and then checking for pH less than or equal to 5.5. Option C, infusing water or air and listening to gargles. Option D, X-ray. Correct answer is B, aspirating gastric juice and then checking for pH less than or equal to 5.5. Thank you for watching. Please like my video and subscribe to my channel. Press the bell icon to get more video.